during those years, both in high school and college, I was actively involved in the athletics and played lots of local baseball and basketball and was fortunate enough to play a little bit of college baseball until injuries eventually derailed that part of my life. And good day, everyone, and welcome to the Richard Kim Medicine Podcast, the medicine that moves you. I'm Evan Marsh, and I am actually the guest on today's episode. We are here today with our hosts, Dr. Richard Kim and Chief Clinical Nurse Cragen Orleman.
Thank you, Evan, for the introduction. And hello, everyone. My name is Dr. Richard Kim, regenerative and sports medicine physician.
And I am Cragen Orleman, the clinical nurse for Dr. Richard Kim at Richard Kim Medicine. And today's episode is titled Complete Therapy, as we plan on exploring, discussing, diving into the importance of the addition of physical therapy into stem cell. And today's guest, Dr. Evan Marsh, who is a physical therapist and co-owner of Capital Area PT.
Thanks, Evan. Thanks for agreeing to do this today, and thanks for taking time out of your busy schedule to come and be with us.
No, thank you. Thank you. This is very exciting, very excited to get into some of this conversation. I know it's one that we've had on the side together, and I'd like to bring it out to the public for everybody.
Yeah, definitely. As we typically start with these sorts of things, we always like to start with the kind of get to know who our guest is. So if you can, in your words, tell us a little bit about yourself, where you're born and raised, what your occupation is, and go on.
Absolutely. So I was born in the Albany area, so a local product here. Went to school in Bethlehem, New York, and graduated high school there. And after high school, went on to Ithaca College, where I was fortunate enough to be surrounded by wonderful practitioners and teachers, and was able to graduate with my doctorate degree in 2008 with my master's, and then shortly thereafter with my doctorate. After moving back into the Albany area, I was employed at Excel Physical Therapy down in Coxsackie. And working with them, I've learned a lot about what the business side of things are. And myself and my business partner, Andrew, had the opportunity in 2013 to open our first therapy practice, Capital Area Physical Therapy and Wellness in Malta, New York. And to date, we finally have our most recent third edition, which we opened just recently, a few months ago.
Excellent. Congratulations.
So thank you. Yeah, we've been surrounded by wonderful staff members. They've really given us an opportunity to grow and expand our practice. And I guess the last is I got the opportunity to marry my wife just a little over a year ago, September 22nd.
Good job with the memory.
2018. Well, it's pretty easy for me. It's what I call my birthday-anniversary. It's my birthday, the day I got engaged, and our wedding anniversary on the same. So I'm trying my best. I try my best.
Plan ahead.
And we're expecting our first baby in February. So thank you. So that's kind of me in a nutshell.
Excellent. So, for you, physical therapist, you explained a little bit about, what it took to become a physical therapist, but for you specifically, what drove you to be a therapist?
So I didn't really find that I was passionate about it until I tore my shoulder when I was in high school. At that time, I was advised not to go the surgical route and to do the therapeutic role. And I was hesitant and wanted to continue just to play. My surgeon had told me that I could push through it, but it would hurt and I wouldn't be as productive unless I did the rehab route. Sure. And I got exposed to a wonderful physical therapist who encouraged me, motivated me, individualized programs for me.
And I can imagine that life experience and that experience both as an athlete and as an individual. How does that flavor your practice as a physical therapist?
Yeah, I believe that having gone through the experiences I have and just to your kind of point, maintaining that active lifestyle, I think it's a direction that gives me relatability, which I think, to your kind of statement earlier, I think does give it some flavor that other therapists may not have. Mm-hmm. I think that when I am able to speak with my high school athletes and look at them in the eye and say, I also have been unable to participate in a season. I know what it's like, both socially, mentally, physically, to have to bear that burden. I think I can help them through it a little differently. I also know what it's like, the importance to add the humor into it all and bring some, I think, personal levels to treating my patients. I don't like to put up a wall where I'm simply just a therapist, you're simply just a patient. I get a lot of carryover by involving them into some of the interpersonal relationships that are built in those moments, the intimacy that physical therapy brings to the proximity alone, just the nature of the business, which you're holding hands with people and through the care of it all. And physically, I'm grabbing shoulders, I'm grabbing necks, I'm grabbing limbs, and we're close by. I think creating that relationship and going through the processes I have allowed me to better understand where they're coming from. And as a result, I think that we as a practice, especially at Capillary PT, help to, I think, bridge that gap from both professional to personal, yet achieve the goals that patients themselves are looking for. And knowing what that meant to me as an individual when I was younger helps me go into the process thinking I'm here for you. I know the goals I have to set for you. And at the same time, let's work on this together and make it a fun experience as best we can.
Yeah, I mean, I think certainly for not just you and for both Cragen and I, we both played a lot of sports growing up, and it certainly influenced kind of our ability to be relatable, you know. And I think one of the things that really we derive a lot of joy out of is watching people, you know, get back to some of those activities, and then watching them get back to, you know, something that you know it's healthy for them, it's stress relieving for them. Certainly for myself, I played a lot of tennis and I played a lot of golf, and that was a lot of what sort of drove us in terms of the activities that we like. And Cragen, you jump in here and I'd like to hear your 2 cents on this, but I mean, I knew you were pretty active growing up as well.
Yeah, I was pretty active. My brother and my father were both very active in, you know, pushing me to be, I would say, a high level athlete. I had a natural talent when it came to like running. I was a pretty fast runner.
You can't see him, but he does look fast.
But
he does look fast.
because I had a bit of a smart mouth, and I had to run away from my brother a lot. And so,
brothers.
When you have that fear of getting beat up, you tend to get fast.
Yeah, right.
But yeah, I mean, I skied a lot. I golfed with my father and my brother as well, and we also did a lot of pickup, football and baseball games. But I see that like the great importance, in if you don't use it, you lose it.
Absolutely.
And how this is basically affecting most, if not all, of our patients. They're in these situations where they're in pain and they're not moving like they once used to be able to, and muscles tend to atrophy and to weaken, and they basically, they lose it. They lose that function. And with that loss of function, they cause this uneven wear on their body. I mean, what's your opinion on that?
So I think that one of the things I think it's important to even just kind of note, and I think all three of us would agree that activity doesn't necessarily translate directly to the word athletics, right? I think that's an important distinction. I think there's a lot of people that get quickly caught up on, I'm not an athlete, so this is an okay thing for me to experience. I hear all the time, well, I'm 72. It's supposed to feel like this. And I think that's one of the...
Do you think that's true? I mean, is that...
Absolutely not.
Yeah.
I don't. I think that if you look through the plethora of healthy moving individuals that we all encounter interpersonally or even just casually in our everyday lives, if we're going to the store or if we're at the mall, we're in the park, I can tell you from 5 years old to 95 years old, I've been impressed and confused at the same time of how some people debunk that ageism kind of philosophy that I'm 72, I'm supposed to feel uncomfortable.
Right.
And at the same time, I'm sometimes surprised at the bad movement patterns, to you, Craig, and your point, that some of these people can have and the wear and tear that it can put on their bodies. And some people shock me as to how far they can really push those limits. I think there's a lot of people that come in to my office, and I have to believe your experiences also speak to this, which is people are coming in with movement patterns that I thought, oh man, I'm surprised it took you this long to get into one of our offices. Yeah. And I think that it's the wear and tear conversation is a tough one because I think people have magnificent compensatory capacity.
Sure.
And I think sometimes for the worse. By the time they end up in our eyes, I think it can sometimes be not too late in the game. There's never such a thing, in my opinion, as too late. And I think that speaks to the kind of medicine that is done here. But at the same time, I think it's impressive of how well the human body can just move if you do what's appropriate for it. If you treat it well, it'll treat you well for a long, long time. Personally, my great-grandmother Fox was 103. And
impressive.
When all was said and done, I remember even in her early hundreds, which is a wild phrase to say. I don't know how to say that right. Yeah. She and her sister were still going to the pool, being brought there. Someone was driving them, but they were going to the pool every day and doing activity. And I've seen it firsthand in that sense that if you are active and you maintain that activity, you can still stay mobile. Now, at 103, was she going to be playing baseball with my nephews? No, not at all. But what was she going to do? She was going to be ambulatory. She was going to be comfortable. She wasn't in pain. Yeah. And I think that speaks to just what the capacity of the human body is if you really do your due diligence to treat it well and not let it go through unnecessary wear and tear.
Yeah. I mean, I think you're talking about a lot of the similar philosophies that we have, and it's just trying to maximize, what we have and then try to maintain that maximum for as much as possible. I mean, you and I have been sharing some patients, both the stem cell and non-stem cell patients for quite some time now. From your PT's perspective, how does something like regenerative medicine and stem cell therapy fit into your approach?
Sure. So I think the first part to that is, from a PT perspective, how does regenerative medicine fit into our approach as therapists? I think that it's given us an opportunity to be exposed to a population that otherwise would have had to go the route of potentially replacements or be devoid of therapy at all. And it's given us an opportunity to almost get a clean slate with patients. I think that's the way that in some ways we can look at this. Yeah. Is it looks at certain...
clean. Explain that a little bit. Clean slate, and what do you mean by that?
So I think that when you see some of these patients that have first crossed your path and make the decision after probably some treatment that hasn't necessarily improved their function to their liking, they elect to go with you this route of regenerative medicine. And I think that those patients now have both the biological and physiological environment to move and be exposed to movement patterns that they've almost long forgotten and have not had the opportunity to achieve because of restrictions or arthritic changes or degenerative changes in joints, and now have a capacity and an opportunity to restore movement. And I think that's what regenerative medicine has done for the therapeutic world.
Sure.
It's given us an opportunity to have that patient in an atmosphere and an environment, biologically and physiologically for themselves, in front of our eyes as therapists, and have a chance to now move more pain-free and learn those patterns again that helps the entire system, not just their musculoskeletal, but I have to believe it also has to have impacts on their mental health.
Sure.
It has to have impacts on their body systems as a whole. And I think that it gives them, that's the clean slate. It gives them an opportunity to then pursue things that they might have rinsed off, if you will, or really avoided for a long time. And in terms of the patients you mentioned that we've had a chance to see, I think our success has been very good in specifically helping patients create goals, practical, reasonable, and appropriate goals to get back to activity the way that they need to. I think it's been a wonderful experience to also have the interpersonal and professional relationship with your staff that allows us to have better carryover. I think knowing that we can reach out to your staff and get reasonable answers in a reasonable time frame. Patients aren't held up and they're not limited in their ability to maybe come into the therapy office. I think we are good at making sure that those patients get seen the way they need to. They also, your staff has been wonderful at answering the questions outside of the specific joint per se. If someone comes in with a knee issue and they end up getting some sort of treatment on the knee, well, I might have a question of their spine, their ankle, their hip. And your staff is wonderful at helping that and bridges that gap that I think a lot of therapist-doctor relationships don't necessarily have that same rapport.
Yeah. I mean, when I first started the practice, I, was trained, I guess you can say, in the new school, in the sort of new era. But, my vision very much from the practice was sort of an older style where people would still answer the phone and, my staff and myself would be available, to the best of our abilities. And I think that, by trying to set that as the bar and trying to achieve that, I think helps develop some relationships, as you're mentioning, just with physical therapists like yourself. So I think that's definitely part of it. I'm going to go backwards on a little bit of what you just said. And you're talking about trying to make this healthier environment. And I think I can't emphasize or stress this enough, but the idea of when you're in pain and you have this, therefore, unhealthy environment, and that unhealthy environment is exemplified by pain, meaning that the pain is the signal that it is not well. And in doing these sorts of procedures and doing these sorts of processes, we're trying to make for that healthier environment. But it's so much more than just simply putting a needle into somebody's joint space or putting a needle into somebody's back. It's really about, sort of approaching the person as a whole. And for whatever reason, I don't like to use the words wellness or wholesome or holistic. It's not enough, I think. It's more than just this wanting of trying to make every part of that person better. It's about introducing, the right dietetics and seeing a dietitian and seeing the right therapist and doing the physical therapy. But when it does come to physical therapy, you guys see our patients way more than we do. We oftentimes are the ones that, help formulate the plan, but quite honestly, filling in the details and able to do and how they're able to progress in some of the therapies really sort of lies on you. We have a patient in common, Olivia Harrison, who also was our guest. What I'd like people to hear in some of this is what it was like, not just from her perspective, but other people's perspective. And from the physical therapist perspective, what was it like working with her and watching her clinical progress?
Yeah. So I think there's two parts to that, specifically with her. And I think this can touch on, my experience as a whole with almost all of, if not all of your patients. And with her individually, I remember very much this woman who came in with this desire and enthusiasm to return back to a life that her words were almost, it's lost. I haven't been able to do this in 16 plus years. I remember very much, I think off the top of my head, her history, which was she was a collegiate runner in St. Rose. And
which I didn't know. I just actually learned from talking to her now.
And she had suffered some injuries.
Yeah.
And I think the injuries beget more injuries. And little by little, more surgical interventions were done and poor outcomes were had. And she was beyond motivated and thrilled to have an opportunity that there was still a hope. And I think that that's where your office first came into play, which was there was hope. There was hope that this couldn't improve. And then by the time she came to me, she had already had the procedure of the stem cells. So I know that she'll have probably talked about what that included for her. So by the time I saw her, it started off with just looking at her as a whole. And I think you said this a second ago. It's more than, just this one part of a puzzle. I think when we as the therapist staff, especially with your patients, we do this with all, but specifically, we really like to say, how are you moving in the other areas? How is your mentality with this? How are you feeling with this? Let's create goals. Let's talk reasonable about your goal planning as this process is started now, because by the time we see them 4 weeks, 6 weeks out, we're sometimes just at the start, and they are so enthusiastic about being pain-free.
Sure.
I remember her coming to me, I feel great. I want to move.
Right.
And so to sometimes slow people down was a struggle. And Olivia was a fun one with that because she was so motivated. She would have, if I told her to jump off a building, she would have. Yeah. And luckily I didn't. But so she was wonderful though. It was motivating to have someone motivated in the door, and it was easy to work with. And so what we did is walked her through the basics, looked at everything. How is her lumbopelvic control? How is her spine moving? How's her ankle moving? Yeah. How are these hips that haven't probably gone through the running form in 16 plus years? So we started really basic. We really went through, I think, a smart process of checking off the boxes and doing all the prerequisite work that for her individual goal setting, that was what we tried to do. We tried to implement a program that allowed her, number one, to be pain-free and maintain health of the joint. Number two, to get back to a lifestyle that meant pain-free. And then three, get back to running. And so we really went slow. And to your point, the details, they ebbed and flowed week to week, month to month as we went through this process, because as she started to develop more strength, I was able to see her a little less at first and
Sure.
said, well, you're still not in the running phase, but you don't have to see me this volume. You can work on some of this at home. But when we're ready, we have to cross that next bridge. So
Sure.
then we came back together and we started going through the pre-running programs, which isn't so much here's a sheet of paper, here's what you have to do, but you as an individual runner, Olivia, let's try to come up with what that means. And remember that you might have been familiar with running multiple miles, but you haven't done that in a long time. A long distance right now, maybe 5 minutes of running. And so that's when things got a little, I think, complicated in a good way for us, because you're now trying to balance the physical components of movement, strength, stability, joint mobility, with someone's desire and feeling pain-free. And I think that her motivation allowed us to push her appropriately and quickly. And I'm sure she must have touched on, unfortunately, she got into this point where as we developed more of a running program, she started developing this medial knee pain, and which is common, I suppose, in the runner's world. But for her, it was, I think, crushing mentally at first. And I think that was hard for me to even have to deal with, because here I am helping her get to these goals that she's achieving, and now she's coming in with a setback again. And I think that can be hard for any individual that's in the rehab process, but specifically someone who's invested so much time and energy and gone through it.
I mean, so much of that is part of athletics and activity, right? I mean, you do an activity and you get these setbacks, and it's about trying to figure out what it is and trying to make it better, and then developing a plan around that, which I think thankfully with her we were able to do successfully.
Yeah.
And Craig, you see a lot of people at that initial 4-week mark. So for our procedure, we see people at the first follow-up visit at 4 weeks. And by that point in time, people have had a little chance to evaluate the process and evaluate things and what it was like. When it comes to that topic of and conversation about physical therapy and what to anticipate with physical therapy, as often you're having that conversation even before I get to walk into the room, what is your sort of advice to people and, in trying to help people understand what to expect in the next coming weeks?
Yeah, at that point, our patients are real eager to get started with physical therapy. It's kind of like that. They underwent the 4 weeks of kind of limited activity, taking it easy, and they're kind of chomping at the bit to really get moving and see what they can do. I mean, a lot of our patients are extremely active people. And so to kind of limit their activity for that period of time can kind of make them a little stir crazy.
Yeah.
But
I mean, we're talking about people who are used to working out, used to being active. And so
used to working.
Yeah. And so they've been waiting for this moment for a while.
And so, they're real eager to see a physical therapist and to start learning these types of exercises to strengthen the muscles surrounding the joint that we did the stem cell therapy on.
One of the things that I wanted to talk about was, for a long time, I've thought about this sort of concept, and this theory is that, pain is a perception and not just something that we vocalize or experience, and what we say to somebody else, but what actually the injury is, and then what our brain receives. And I really believe that's got to be individualized, just like we're all individuals. And when I see people and I see different sort of injuries, I say, well, that should really hurt. And some people are saying, well, no, that doesn't hurt at all. And I see other people and I say, well, that shouldn't hurt that much. And, they're in agony. It really teaches me a lot about the multifacets of pain. And it's not as simple as saying, well, you have X, Y, and Z on this MRI, and therefore you should be in this quantity of pain. And it doesn't correlate and that well, even though we probably all wish that it does. I never quite understand how I think the next step of that evaluation process in my brain goes, though, whether, is it a role in genetics or is it in our ability to cope with some of these things? What do you think about my sort of thought process there in pain and how we think about pain? Because I mean, quite frankly, I think we don't have the best understanding of it.
Yeah, I think that in my recent years, I would say easily more in the last 6 versus my didactic education at school, I've been exposed to pain science as a educational part of what I have to do on a regular basis. And I think that, to your point, it is a multifactorial component. Your past experiences, your current
Sure.
health, your current perception. If I expect something to hurt, chances are it's going to hurt a little bit more too. I think tying it into genetics is interesting because I think that you can express pain very differently. And I think genetics and things are expressed differently.
And when we talk about expression, we're not talking about what we say and vocalize.
Correct.
We're talking about expression in terms of like where, how much of the pain receptor is being stimulated and uptake is happening.
Correct. Yeah. And I think that's the part that's interesting is individuals can have those, that's one of the parts of the multifactorial component is this kind of genetic or cellular expression of pain. And I think we all see it and we all have experienced it in one way or the other. Our friends or family members or patients for us is people who have broken arms and even had bones come through the skin, and yet they say that didn't hurt so bad, but I can remember when I stubbed my toe, that killed me. And that doesn't make sense, right? Physically, that doesn't make sense at all. It should hurt infinitely more when you break a bone and have it go through your skin versus just a stubbing of your toe. But why does that pain manifest more? Well, maybe it's not just the physical parts of pain. Maybe it's you start going into this cascade of I start to think I'm not going to be able to walk. And if I can't walk, I can't work. If I can't work, I can't make money. I can't feed my family. And all of a sudden pain can just manifest infinitely larger because of how we are thinking about it. And then maybe our past experiences, if I hurt my foot, well, I missed out on this opportunity to participate in this event. And as a result, my family members, they all had this wonderful experience that I missed out on. And that's playing a role in how I'm now feeling pain in my foot. But, hey, if I broke my arm, so what? Worst thing that happens is I still walk around. I still have those experiences because I'm thinking about it that way. Now, it's much more complicated, of course, but pain, I think, on a genetic level is the next part. I think we're finding out more and more about it, that pain isn't simply a physical manifestation of how much damage or how much of an area was exposed to a stimulus. I think it's more about these perceptions and these expressions, from a genetic and cellular level as well.
Yeah. Craig and I, you've had a pretty broad experience with pain as well. Prior to us working together, you were a hospital bedside nurse as well. What are we doing well? What are we not doing well?
Well, I mean, pain is incredibly individualized. And what we don't do well is sympathizing with that, because if we're biased, perhaps, it's like, oh, well, I did that. I stubbed my toe.
Sure.
It doesn't hurt me that bad. It shouldn't hurt you that bad. And we got to get out of, I guess, that mindset. And I mean, that's the whole reason why, we're doing this to begin with, why Evan is a physical therapist, why we're here trying to help our patients with doing an alternative therapy like stem cell therapy. Because the one thing that is common that everyone shares is they have pain. It's causing them to slow down or not move as much as they did, or move in a way that is abnormal, which then causes more pain, which then causes them to have pain in other parts of their body, which, weren't there to begin with. And if we can give them the building blocks, give them the means to invest in their health, in their well-being, to help facilitate that, this option such as stem cells to basically take the pain away so that they can participate effectively with physical therapy, so they can have a window of opportunity to help rebuild muscle that has atrophied, or that muscle that, the strength is just not what it once was. That's everything.
Agreed. And I think one of the things that you touched on a second ago that's really powerful and I think important for all of us is the language around pain. And I think that's something that I think we all do better at as we practice with more patients. I think as my conversation around pain is better now. And I think when you talked about sympathizing, I don't want to say I was guilty of it, but I'm sure I was without knowing it. I think we all are.
And it's not like the psychological, we're trying to convince people out of it, but there is a language approach to it that, I really feel like is important because it helps us to both get, an understanding of what we're doing to people essentially, and then give feedback on where to take them next. Right. And people are, sometimes thinking or feeling that, look, we're either not totally in understanding or totally in agreement, but it's more than that. It's really about us sort of critically assessing and analyzing what's just been said to us, and then deciding on how that feedback is going to come out and what do we do next, right?
I think one of the harder parts in the language of pain, especially in the roles of physical therapy as well, is when, especially after they've had an opportunity to be exposed to something like stem cell, and the opportunity is so great, so wonderful. I think at times it's about creating reasonable goals in a reasonable time frame. I think the time frame part is the trickiest part for us.
Yeah, that's a tough one, because I think we all have different, expectations, and we all want what we want, I guess.
Yeah. But I think the best part about being in this environment, and I think in this group that I'm sitting here with right now, is that we've all seen what traditional care looks like, and I think that when you're in that, I'm going to call it a system, when you're kind of in that system, things sometimes do get, I'm going to say, poo-pooed. It's hey, this is you're 72, this is your knee, and that's what 72-year-old knees look like.
That's unfortunate.
And I think that's the wrong language. And I think when we talk about language of pain, it's, to your point, it doesn't have to be this complex psychological conversation. I think it can be something as basic as, hey, you don't have to live like this, but if we want to get out of this, we might have to change some things. We might have to change a dietary plan. We might have to change how we approach it. We may not be able to approach it with traditional medicine, care. And let's now go into this path where, the physical components we can look at, but we might have to bring you to, or be exposing you to different kind of practitioners that are going to look at it differently than how you've been looked at already. And that's why it hasn't worked yet. And that's the really cool part now.
Right. I think that I agree with everything that you said. It's about trying to open up our possibilities and opening up the avenues here when you've tried traditional and traditional has not sort of met the needs, right?
Well, let me ask you both this then. I'll kind of quickly piggyback this to a question.
Sure.
So you have to, by default, I'm sure, get exposed to so many patients that have gone through the gamut of past physical therapy, past acupuncture, past chiropractic care, past orthopedic and doctoral care. They now come to you, I have to believe at times, sometimes looking for either a magic bullet, or more importantly, just saying, hey, you're here because we know what is possible, or this is an approach we've heard that is giving other people an opportunity to move differently. How do you necessarily get that patient to buy back into movement with other practitioners again? Because I think that has to be a little bit tricky.
Yeah, when you lose sort of a bit of faith, right, in the process. I think this is going to go back to what I was saying before, but that original sort of doctor-patient relationship and trying to create this trust. But you gain that trust from doing right by the patient, right? You're doing that which you think is in the patient's best interest. And while it sounds sort of global and maybe like in the ether a little bit here, but I think if you focus on that and you say, look, this is what you've seen and evaluated the kind of practitioner that I am, the kind of physician that I am, you then present these ideas and you say, look, you can baby step into it. You can toe into it by trying, instead of this long, prolonged 6-month course of physical therapy, why don't we just try 4 weeks? Give me once a day for 4 weeks. And I know, when I send them to either my dietitian, my, sports psychologist, or even more importantly, my physical therapist like yourself, that you guys are going to be sensitive to the fact that this is where that person came from, or this is the environment that they came from, and it's now in part addressing, yes, the knee pain, and yes, addressing the ankle pain or whatever, but it's part of it is regaining and rebuilding that trust. I think by doing things that work, right, and by making sure that the right patient gets the right therapy, you help win that trust. I won't say automatically, but it gives you confidence that you're putting people in the right path. Certainly.
Absolutely.
And when you're seeing patients and they're coming to you for an issue that they're having a great deal of pain in, and you're telling them to do this type of exercise slowly, they're still having significant amount of pain. I mean, are they going to be able to do that with the proper body mechanics that are intended for that type of exercise? I mean, this pain is the limiting factor. It's all about a patient being able to participate. If they're in pain, they're not going to be motivated to participate.
Sure.
Yeah, 100%.
And so
That's true.
the whole time with you is this horrible, excruciating experience. And so, they associate you with discomfort.
Sure.
Absolutely. Sure.
And if we can give them the means to where they start feeling a little bit better, and then at that point in time, they can start working with you, they can get that motivation when they say, I'm feeling better. I'm working with a physical therapist. He's working my muscles. I feel good. I feel like I can do this.
Yeah.
And it's like this mind over matter where you have a positivity about it now, where it's not, I'm in so much pain. I can't do it. There's no hope.
Yeah. It's like a band playing on the right cues, right? When the instruments are all playing at different times.
Right. The symphony sounds great.
The symphony sounds great.
Yeah.
And that's just it. I think that's important. I think if people don't get exposed in the right, maybe order, or more importantly, and at the right times, if they're not building up at the right time and quieting down at others, the concert sounds terrible. And that's the pain that you're talking about.
We're all part of that symphony, and we're all doing our parts and ringing the bells at when we're supposed to. A little bit about some of this process, though, is I want to hear your perspective on what can people do to help prepare themselves going into a stem cell therapy to put themselves in the best possible light or the best possible situation so that they can have the best possible result afterwards.
So what's a preemptive approach to stem cell therapy, right?
Yeah,
From a therapy.
exactly.
Yeah, so I think that it begins with understanding what healthy movement even should be. I think if you're never exposed to healthy movement and understanding the approach to that, the biomechanics, the kinematics, and also the work that has to get put into it. I think all of those parts are important to learn beforehand. I think you have to learn the concepts that a joint never moves in isolation, that a joint moves as a group, that chains in the body. We talk about kinematic chains all the time, that your upper half and your lower half have to work together. So
talking about symphonies again, right? Another example.
I think that when we talk about how do we prepare patients for this, I think if you were to ask pre-physical therapy for stem cell or PRPs, I think that the best exposure is creating a plan that almost mimics your immediate post-operative. I do. I think that if you are exposed to what that process should look like right after.
Kind of like muscle memory, do you think? Like just starting to build some of that pattern, even if it is uncomfortable or painful, at least you know what that's supposed to look like.
Waking up some of that neurological system.
That's a really good idea.
I think that it starts probably with learning what you should do after. I would imagine that if you're exposed to that beginning part, the first part where your body first has the opportunity to move well, if you knew what that was like going in, you're mentally prepared and maybe even a little bit more physically prepared. And I think that having somebody, or even just yourself, just start moving. I think movement before you go into this is the most important, because you're asking usually joints that haven't moved, and it may be uncomfortable at first. And I think that that's the part to get through. If you can understand that getting through this appropriately and effectively, and learning how movement should happen, I think you're set up for success. And I think that that's important. I don't know if I've been exposed yet. I think because of how you look at things, I don't think I've been exposed to anybody. I know I haven't. That's gone into this cold turkey. I think people know what to expect out of therapy. I think they've all been exposed to it beforehand.
Sure.
And even if they hadn't, I think that knowing that the kind of conversations and the work that goes into the patients that you work with, I think they all have an understanding of what it is. But if clean slate was given, understand the post-operative care, I think, is the best part.
Yeah, I mean, for us, it's sort of baked into the cake. Once you come in for the consultation, then it's up front and center, the fact that it's not just the stem cells that are part of the therapy, but it's the physical therapy, the dietitian, and everybody else that's involved that makes for a successful outcome. So I mean, we don't typically get a lot of people like that who are cold turkey, never seen or never exposed to the idea of physical therapy for this process.
I feel that our patients are highly motivated. Like I said, they're very eager to get started with physical therapy. What would you say their mindset is? Do you feel that they're more proactive than most, or like are they in good spirits, or
Sure.
they have a positive attitude? What's your take on that?
I think there's an interesting dichotomy of, at the same time, there's almost two people that come in the door, even though it's one person.
Mhm.
There's one half of them that's motivated and enthusiastic and they want to move. But I think there's also this skepticism of, I've never moved well, that traditional therapies may have not done me well up to this point.
Right.
So I think that there's and skepticism, not so much in the people, but just themselves, that I may not be able to achieve this. So I think that knowing that and having the experience of working with people that have gone through this kind of procedure, I think that as a group, my practice, they've all really been really helpful at understanding the kind of patient that walks in the door. And I think that knowing that these are people that traditionally haven't moved well, that might have failed before, but more importantly are motivated. I think that's one thing that is evident. They're all motivated. They all come in with good spirits. They all come in positive.
That's a very key part to all of this. And we've talked about this before, but for people who are looking to get better and looking to be active again and reclaim their lives and get their sense of, activity and satisfaction back, that is such a big part of, going into this and getting a successful outcome.
Yeah. I think it's paramount that they come in enthusiastic. I think if they don't, then I think they're setting themselves up for success. I think when they come in knowing that clean slate is there, I believe that that's the best opportunity to re-educate a system that hasn't been moving well, or that just has now an opportunity to move healthily and again, with a little less pain. And I think that's where it begins. And I think our conversation at day one starts that way. I think when we talk about how do patients even walk in the door, I think that especially the group that I've surrounded myself with at Capillary PT has been really wonderful, that we take that first session is an hour long, and it's just sitting and talking and going through the conversation, the backstory. We want to hear that patient's story because we know that there's a lot that goes into the care that's provided both on your end and ours. And I think that once they are coming to us.
And that's such an abnormal thing nowadays, isn't it? An hour-long sort of personal evaluation and care. Certainly, I know my patients appreciate that from you guys.
Yeah, I think it's one of the things that has helped to set us apart a little bit. I think it's given us an opportunity to connect a little bit more intimately with our patients and our caseloads over the years. And we get a lot of returning patients in that sense, patients that come from friends and family because they recognize that the kind of care that they've been receiving has been valuable. And what we like to look at and how we've really implored our staff to look at things has been never look at a joint, look at a person. The person will tell you
such the truth,
how they are feeling. I tell my patients all the time, you're the expert on you, but I'm the expert on how you move.
Yeah.
You might not understand the joint, but you know how you feel. If it hurts, that's you. That's your experience. You have to tell me that. And once we start going through that conversation and the minutia of the therapy evaluation and the sessions, I think that they all experience and find that we look well outside of the box that is this little microscopic view of a joint, and we look at them as a person, and it involves just something as basic as walking is a whole body movement. And I think that we help them recognize that it isn't about a head or a knee or an ankle or a foot. It's about a body. And if the body doesn't move, that hip still will not move. And I think that they start to see that in how we approach the body. And that's kind of the day one. We help set that stage. Our approach is always look at you first, big, and then we'll come in small.
Sure.
And I think that they've gained good success with that. And I think our patients have really had the opportunity to get back to the things they want. If you kind of go back to Olivia, here's a woman who didn't run and for 16 years and did. And she's still in that goal of 5K running, and she's going to be there. And it's no doubt she's going to get there. And I think when she started realizing that it was more than this knee, I think that was the big wake up moment of sorts for her. It was about a foot. It was about a hip. It was about a back and a core and how the trunk and shoulders had to be involved. And I think she started seeing that the picture was bigger. And I think it gave her an opportunity to move. And I think as a whole, she's an emblematic of patients as a whole.
I appreciate all of that. I couldn't agree with you more that, it really does take a whole person evaluation, and it takes a whole person sort of treatment and therapy. Well, thank you, Evan Marsh, for coming down and spending some time with us. And to everybody out there, thank you for listening to the Richard Kim Medicine Podcast. Please visit us at richardkimmedicinepodcast.com, or you can find us on YouTube or SoundCloud.
Yes, thank you for joining us.